Welcome to today's explainer. So, today we're diving into something I think we all secretly love, medical dramas. You know the exact scenes I'm talking about, right? The alarms are blaring, the suspenseful music starts swelling in the background, and some rogue, maverick surgeon decides to try a completely unproven, incredibly dangerous procedure just to save the day. I mean, it makes for absolutely incredible television. But it really makes you wonder, how much of that is actually true? Well, today, we're going to compare those crazy, over-the-top TV tropes to the meticulous, highly calculated reality of actual neurosurgery. Let's get right into it. You know, when we watch these shows, we're usually on the edge of our seats. But real-life neurosurgeons, they are literally shouting at their screens. Take our main source for today's explainer, Dr. Kazu. When he sits down and watches these miraculous, dramatic TV surgeries, his reaction is usually just pure exasperation. He actually says that surgical procedure doesn't exist anywhere in the medical world. It's honestly a pretty hilarious image, this highly trained expert just throwing his hands up in defeat at his living room TV. But honestly, it sets the absolute perfect tone for the myths we're about to unpack. Which naturally brings us to a really valid question. So, are medical dramas just straight up lying to us? Well, yeah, they're definitely bending the truth for entertainment value, but the fun part isn't just pointing and laughing at ridiculous TV tropes. It's actually discovering what really goes down inside a real operating room. Because as you'll see, the truth of actual medicine is way more intricate and awe-inspiring than anything a Hollywood screenwriter could ever dream up. Now, just to make sure we've got our facts straight, all the insights in this explainer come directly from Dr. Kazu, and he isn't just some armchair critic complaining on the internet. He is a former medical school associate professor and a highly experienced, actively practicing neurosurgeon. He literally spends his days specializing in critical, high-stakes procedures involving strokes and brain tumors. So as we bust these myths, you can be 100% confident that everything we're talking about is grounded in real, life-saving experience. Okay, let's tackle our very first myth. The classic TV trope is always that unprecedented, risky miracle procedure. The rogue doctor bets it all on a massive gamble. But let's look at reality. Real doctors, they never ever gamble with your brain. Instead, they rely on strict adherence to proven, standard treatment guidelines. And why is that? Because those guidelines aren't just guesses. They're built on massive mountains of global data. We're talking millions of successful cases that prove exactly what is safe. In the real world, a miracle isn't some random gamble. It's the result of rigorously proven science. So if they aren't making up miracle cuts on the fly, what are they actually doing? They rely on highly advanced, established techniques. The two major ones you'll see are the craniotomy and the endovascular catheter. A craniotomy is your more traditional method, where the skull is carefully opened, and surgeons use high-powered surgical microscopes to navigate around nerves with literally millimeter precision. But then you have the endovascular catheter, which is just a total marvel of modern medicine. Doctors insert this tiny tube into a blood vessel in your thigh or your wrist, and they navigate it all the way up into the brain. They treat the issue without ever even cutting into your head. Both are insanely complex, but the key here is that they are established, not invented on the spot. And that brings us to the next big trope, the dramatic light bulb moment. You've seen it. The surgeon freezes, stares intensely into space, suddenly visualizes a brand new way to cut, and just goes for it. Let me be perfectly clear. The human brain is way too delicate for improvising. In reality, an unplanned cut doesn't trigger triumphant background music. It leads to instant, devastating consequences, like permanent paralysis or totally losing the ability to speak. Just a single millimeter of deviation can completely alter a person's life forever. Because of that extreme risk, there's one crucial number you need to remember, and that's 90%. A massive 90% of a successful brain surgery is actually completely decided and finished before the patient is even wheeled through the operating room doors. Yep, the vast majority of the real work happens in the planning phase. Before the surgeon even makes that very first cut, the entire team already knows exactly what they are going to do, step by excruciating step. So how exactly do they achieve that 90% completion before surgery? It all comes down to intense, meticulous prep work. First, they run high-resolution MRI scans and 3D vascular imaging to build a perfect three-dimensional digital clone of that specific patient's brain structure. Then, they use these advanced navigation systems preloaded with all the safe routes around critical nerves and blood vessels. Think of it like a highly advanced GPS system, but for your brain. By the time the operation actually starts, that safe route is practically guaranteed. All right, we absolutely have to talk about one of the most famous TV tropes of all time, the emergency drill scene.
A patient crashes in a stuck elevator, so the maverick doctor grabs a handy power drill from a toolbox to relieve pressure in the skull. It is fantastic TV. But while drilling into a skull is a real thing, it is never ever done by guessing in a dirty environment. The actual reality is called calculated trepanation. It requires incredibly precise imaging to know exactly where to drill, and obviously, it requires extreme infection control.
Actually, the real medical condition that inspired that whole crazy TV trope is often something called a chronic subdural hematoma. Basically, this is when blood slowly pools between the skull and the brain, and it gradually compresses the brain tissue. The real-world treatment for this is Burr hole surgery, and it's highly controlled. The surgeons carefully drill a tiny 1 centimeter hole in the skull and then just gently wash the pooled blood right out. It's an incredibly safe and effective procedure, but again, it requires careful scans and a completely sterile room. Definitely no hardware store drills involved. And all of this brilliantly highlights exactly why precise diagnostics are so vital during rapid-fire brain emergencies, like strokes, for instance. There are two main types of strokes, and you absolutely cannot just guess which one a patient is having because the treatments are complete opposites. If it's an ischemic stroke, that means a blood vessel is blocked by a clot. To treat it, you use TPA medication to dissolve it, or a catheter to actually pull the clot out. But if it's a hemorrhagic stroke, a vessel has burst and is actively bleeding. Treating that requires a craniotomy to place a metal clip over the vessel, or using a catheter to fill it with tiny coils to stop the bleeding. Reality demands exact medical pathways. Guesswork here is literally fatal. Now, if you're sitting there thinking that reality sounds kind of boring compared to TV, think again. Because sometimes the real techniques are actually way more dramatic than fiction. Take awake surgery, for example. When surgeons are removing certain types of brain tumors, they have to be absolutely certain they aren't accidentally damaging healthy tissue. So what do? They literally wake the patient up right in the middle of the surgery. They will sit there and have a full conversation with the patient, checking their speech and motor functions in real time while they remove the tumor. It is a mind-blowing procedure that really proves truth is often way stranger and cooler than fiction. Okay, I want to pause here for just a second and totally shift our focus. We've had a lot of fun debunking these television myths, but there is a very real, critical takeaway from Dr. Kazoo's insights that we need to talk about. Real emergencies do not come with dramatic background music to warn you. There's no suspenseful swelling of violins right before a loved one has a stroke. In the real world, everything happens in silence, which means early detection is absolutely everything. When it comes to the brain, time literally saves brain cells. Because every single second counts, I want to urgently walk you through something called the FAST rule. This is exactly how you spot a brain emergency. Step 1 is F for face. Look at them. Is one side of their face drooping or looking uneven? Step 2 is A for arm. Can they hold both arms straight out in front of them, or does one arm start drifting downwards from weakness? Step 3 is S for speech. Ask them to just repeat a super simple sentence. Is their speech suddenly slurred or hard to understand? And finally, step 4 is T for time. If you see even one of these signs, it is time to call an ambulance immediately. Do not wait to see if they feel better. Call right then. Now, if someone actually collapses right in front of you, here are the clear, actionable first aid steps you need to take. First, lay them on their side. This secures their airway and prevents them from choking if they happen to get sick. Second, and this is a huge TV trope we need to break right now, do not vigorously shake them or cradle their head up in your arms while yelling their name. Keep them still and flat on their side. Third, and this might be the most crucial step of all, look at a clock and note the exact time the symptoms started. Remember those stroke treatments we talked about earlier? Knowing the precise time of onset dictates exactly which life-saving treatments the hospital is safely allowed to use. So, as we wrap up this explainer, I think the core theme here is pretty crystal clear. Real neurosurgery, and honestly, real medicine as a whole, doesn't rely on reckless miracles, sudden flashes of inspiration, or rogue doctors breaking all the rules. Its true power, the very thing that allows it to save millions of lives every year, comes from meticulous data, exhaustive preparation, and incredibly solid established guidelines. And honestly, that is a reality you can actually trust. Medical dramas are fantastic entertainment, and we should absolutely keep enjoying them for the thrill of it. But out here in the real world, knowing the facts and being able to spot the critical signs of a brain emergency is what actually saves a life. So I'm going to leave you with this final thought. When the dramatic music isn't playing and real life happens in total silence, are you prepared to step up, use that fast rule, and be the real hero? Thank you so much for joining me for this explainer. Keep learning, stay curious, and please share this vital knowledge with someone you care about today.